This one is a tough one, but I think it's important for us to talk about. In all honesty, I wasn't even aware this was a problem in the United States. So when this story came across my feed, I was a little bit surprised. But if I didn't know about it, I figured that means you probably didn't know about it either. And so that's what makes it so important for us to talk about this. And I put together several pieces, so hopefully I can get through all of it in this one video. So it started with this article by Maria Taher, and first I have to say I love the spelling of her name. So the article is entitled Protecting Children from Chemical and Surgical Mutilation in the USA. Now I knew that this happened in other countries, but I had no idea that it was actually currently going on in the United States. But apparently we have a long history of this as well. So the article begins, "It's little known and discussed, but more than 500,000 women and girls are survivors or at risk of female genital mutilation or cutting, known as FGMC, in the USA. I am one of them." And so before we even get into the article, here is an image that shows what is typically removed during an FGMC surgery. All of this, the colored in is removed, and the yellow is sometimes removed as well. But everything that's colored in is removed from the woman, basically just leaving a hole. So then the article continues, "This problem, so often considered to exist only in faraway places, happens right here at home too, and many have fought hard to make that known and curtail it. When the Trump administration made a mockery of the hard-fought 2020 Stop FGMC Act by issuing an executive order that falsely conflates FGMC with gender-affirming care and restricts access to life-saving gender-affirming care for young people, it made me boil." Well, it makes me boil too, Maria. "The order describes gender-affirming care as mutilation and maiming and a horrific tragedy. In doing so, it puts thousands of vulnerable children at risk, survivors of FGMC and trans youth alike, and pits them against each other. Let me make it perfectly clear. FGMC and gender-affirming care are not equivalent. Not only do I know because I'm a survivor, but I also co-founded an organization that has supported hundreds of FGMC survivors over the years. Here's the difference. FGMC involves removing part or all of a girl or woman's healthy female sex organs and surrounding tissue for non-medical reasons and often results in negative health consequences, difficulties during childbirth, lifelong psychological and emotional trauma, and in some cases, even death. It's considered a human rights violation and an extreme form of violence against women. Gender-affirming care, on the other hand, is a medically necessary form of care that includes a diverse array of interventions to align one's identity with their sexual characteristics. This care is only provided with the consent of the individual, and research has also shown that these treatments lead to decreased rates of depression, improvement in psychosocial functioning, and minimal long-term side effects. FGMC violates an individual's bodily autonomy, while gender-affirming care preserves it." And that's a super important distinction because we're going to look at the executive order that Trump signed that is basically using the laws for one group against the other group to cause harm. Continuing with the article, "But Trump's executive order conflates the two and directs the Department of Justice to use the Stop FGMC Act to coordinate law enforcement to take actions against parents and caregivers who would seek to support their trans youth and help them obtain this vital care. In early February, in response, attorney generals from 16 states released a joint statement to uplift that FGMC is not the same as gender-affirming care. Despite what the Trump administration has suggested, there is no connection between female genital mutilation and gender-affirming care, and no federal law makes gender-affirming care unlawful. President Trump cannot change that by executive order. In issuing this executive order, not only are trans youth put at risk, but the Trump administration has also ignored the voices of hundreds of anti-FGMC advocates like myself who for years have begged the United States government to recognize that FGMC is an inherent part of American culture and comes in many different forms. Last October, nearly 40 women sued an OBGYN at Cedars-Sinai Medical Center in LA for performing the husband stitch, a medically unnecessary postpartum suture that was identified as FGMC by the plaintiffs. I remember after my second child was born, my doctor and my husband joking about the husband stitch and that I should get one. I didn't find it any more amusing then than I do now. All right, let's continue. Like other forms of FGMC, the husband stitch is typically performed to increase men's sexual pleasure. Since October, 107 more plaintiffs have joined the lawsuit. Besides the LA cases, in the last few years, a Detroit emergency room physician was charged with performing FGMC on dozens of minor females, some of whom had been brought across state lines to have FGMC carried out. Additionally, a Texas woman was charged with taking a girl out of the country to have FGMC performed. In Kentucky, allegations of FGMC were brought against a couple who were charged with having tortured a young girl. Back in 2006, a man in Georgia was sentenced to 10 years in prison for conducting FGMC on his 2-year-old daughter. If we go even further back, in the late 19th and early 20th centuries, medical professionals performed FGMC as a treatment for various perceived psychological conditions, including hysteria, lesbianism, and excessive masturbation. Renee Bergstrom, a white, Midwestern, church-going woman, has courageously written about her experience undergoing FGMC as a child to prevent masturbation. I took a quick glance through her story, and it is horrifying what she went through. Advocacy by survivors over the years has resulted in some progress being made to end this human rights violation. Dozens of petitions by survivor advocates have allowed FGMC to be recognized as an official form of gender-based violence in the U.S., and as a result, survivors have begun to receive the support and care they need. More than 41 states have state laws against FGMC. FGMC was included in the 2022 reauthorizations of the Violence Against Women's Act, and resources have been created to address FGMC across the country. And of course, there's the landmark passage and existence of the bipartisan Stop FGMC Act. Today, we can say that FGMC happens in the United States. It has for centuries, and it takes many different forms. But what clearly distinguishes FGMC from gender-affirming care is that FGMC is driven by misguided attitudes about women's sexuality, health, and societal roles. It's motivated by gendered stereotypes about the need for women to be chaste and pure, misconceptions about the female anatomy, a tendency to pathologize women's sexual desires, and a patriarchal system that prioritizes male sexual pleasure and control over women's health and bodily autonomy. Gender-affirming care, on the other hand, requires patient consent and, in the case of a minor, consent and assent from the parent or legal guardian, and the patient after a long period of reflection and consultation with health providers. As a survivor of FGMC and a professional advocate who has come across hundreds of FGMC cases in the United States, I know the truth. Gender-affirming care is not mutilation or maiming. To claim that it is, to conflate the two practices, is an insult to survivors like me and a clear attempt to deny vulnerable trans youth the care they need. It's also counterproductive, jeopardizing the last decade of progress that FGMC advocates have made and putting at risk the lives of thousands of children. Those children need support and protection to be able to live healthy and safe lives, not to be made pawns in a political game designed to hurt other vulnerable kids. There's another article that I want to get to, as well as the executive order that prompted all of this, but I'm running out of time, so I'm going to wrap this one up and start a second video to continue. If you're watching this on YouTube, it'll follow next. This is a continuation of a video I was doing on protecting children from chemical and surgical mutilation in the United States. And in this video, I want to dive into a second article. This one was published in Ms. magazine. And this one is a little bit older. It was published a year ago in January of 2024. But this one was also published by Maria Taher. This one is entitled, When Protecting Girls is Twisted into Attacking Trans Youth. FGMC survivors fight back against transphobic right-wing narratives. But the reason I want to follow up with this article, even though it's a year old, is because of the executive order that was signed in January of this year that is directly related to this article. So let's dive into this article. Trump's recent comments equating trans healthcare with child sexual mutilation reaffirms years of campaigning by the far right to falsely conflate gender-affirming care and FGMC. By the end of this calendar year, which was 2024, 3 million girls around the world will be at risk of undergoing female genital mutilation or cutting, known as FGMC. Currently in the United States, over 500,000 women and girls have undergone or are at risk of undergoing FGMC. FGMC is a human rights violation that involves removing part or all of a child's healthy female sex organs and surrounding tissue for non-medical reasons and can result in negative health consequences, difficulties during childbirth, lifelong psychological and emotional trauma, and in some cases, even death. Efforts are underway around the world to ban this harmful practice, and 41 U.S. states have laws on the books to address it. But the efforts of survivors and activists have been hamstrung by the current wave of conservative opposition to medical care for trans youth. Yet another ugly consequence of the crackdown on rights for transgender Americans. As we try to make sure that girls who are at risk of FGMC or who are dealing with the consequences of it have the protections they need, those who oppose rights for trans people are weaponizing the laws we advocated for to deny trans youth the gender-affirming care they need. So not only are they putting girls and women directly in harm's way, they're also using those women and girls to harm trans people. All right, let's continue. A recent statement from the president-elect Donald Trump confirms this harmful conflation of the two very different issues. One day, I will revoke Joe Biden's cruel policies on gender-affirming care. Ridiculous. I will sign a new executive order instructing every federal agency to cease all programs that promote the concept of sex and gender transition at any age, Trump said in a video posted to social media. I will then ask Congress to permanently stop federal taxpayer dollars from being used to promote or pay for these procedures and pass a law prohibiting child sexual mutilation in all 50 states. That Trump used these words, child sexual mutilation, reaffirms years' worth of campaigning by the far right to disenfranchise the trans community by falsely conflating gender-affirming care and FGMC. This dangerous framing has already had consequences at the state level. Connecticut, for example, has yet to introduce a bill on FGMC, and this weaponization is partly to blame. Last January, the Commission on the Status of Women, Children, Seniors, and Equitable Access for All, alongside the Connecticut Coalition to End FGMC, hosted a briefing at the Legislative Office building on FGMC. The Family Institute of Connecticut Action, a conservative advocacy group, used this briefing as an opportunity to conflate FGMC and gender-affirming care, stating that the two were the same. And then, for no reason whatsoever, we have this quote in bright yellow right here in the middle of the article. We have the tools to protect girls from those who would abuse them, and to play politics with the health and safety of those girls is, quite simply, immoral. I have no idea who said this quote or why it's here. I couldn't actually find it anywhere in the article. In Idaho, in 2022 and 2023, an existing bill on FGMC was co-opted by Republican lawmakers in attempts to equate gender-affirming care for youth as mutilation. For example, Idaho's House Bill 71 sought to amend the anti-FGMC legislation by removing almost all mentions of FGMC and removing the word female before any remaining uses of genital mutilation that were kept in the proposed written bill. Rather than protecting those at risk of FGMC, the bill's focus would have targeted transgender youth. Additionally, this political maneuver would have diluted legislative progress towards ending FGMC that had been achieved by effectively nullifying pre-existing legislation put in place to end FGMC. Ultimately, the FGMC law in Idaho was not altered in part due to the efforts of advocates working to end the practice to keep the anti-FGMC law as is. Yet the seed was planted that gender-affirming care was mutilation, leading Idaho legislators to propose a new bill that did indeed pass and now denies trans youth the vital care that they need. Framing gender-affirming care as mutilation has become a refrain. Republican legislators in Texas did the same in 2022. Utah's Governor Spencer Cox made similar remarks that got him in hot water at an event at George Washington University earlier this year, outright equating gender-affirming care to FGMC. Governor Ron DeSantis of Florida followed suit, proving once again that they will literally use anything to harm trans kids. To understand the harm of conflating gender-affirming care with FGMC, it is important to understand context. First and foremost, any attempt to co-opt anti-FGMC legislation for banning gender-affirming care is built upon key misunderstandings of significant differences between the two, which makes this conflation irresponsible and inaccurate. Gender-affirming care requires patient consent and, in the case of a minor, consent and assent from the parent or legal guardian and the patient after a long period of reflection and consultation with health providers. Conversely, FGMC violates bodily autonomy, and a vast majority of those who experience FGMC have no say in the timing or nature of the cut. It is a social norm that often occurs as a result of societal pressure placed on girls who are told FGMC is necessary for them to be a woman, to be a member of their own culture and society, and to be married. In addition, research has shown that gender-affirming treatments lead to decreased rates of depression, improvement in psychosocial functioning, and minimal long-term side effects. FGMC leads to negative psychological outcomes, including PTSD, anxiety, and depression. In fact, a study published in October 2024 in JAMA Pediatrics reiterates that transgender teenagers who pursue medical interventions are highly satisfied with their care. These outcomes clearly distinguish gender-affirming care from FGMC as a medical necessity. FGMC harms girls physically and mentally throughout their entire reproductive lives, while gender-affirming care for youth has been proven over and over to be life-saving. The National Center for Transgender Equality reports that 40% of transgender people in the U.S. have attempted suicide at some point in their lives, which is nearly 9 times the nationwide suicide rate. Gender-affirming care can significantly improve this mental health crisis. Attempts by conservative politicians to co-opt the human rights abuse of FGMC is nothing more than a discriminatory political tactic to further transphobic rhetoric around medically necessary care for a marginalized community. At Sahio, the organization I co-founded, we work with FGMC survivors who identify as LGBTQIA+. And this culture of anti-trans hate only isolates those survivors further. The costs of such political tactics are clear to those of us who care deeply, both about survivors of FGMC and about trans youth. Pitting them against each other leaves millions of children without the resources they desperately need, whether it's protection from FGMC and care in its aftermath, or access to medical care and support to live as their authentic selves. Equating FGMC and gender-affirming care is not only inaccurate, it's irresponsible. We have the tools to protect girls from those who would abuse them, and to play politics with the health and safety of those girls is, quite simply, immoral. Our children, all of our children, deserve better. Oh, there's the quote from the yellow. No wonder I couldn't find it when I skimmed this in the beginning. And once again, I'm out of time, so I'm going to go ahead and make a third video digging into the executive order that this is all about. And if you're watching on YouTube, I will link all 3 videos together so it's all in one place, and it will follow after this. We're at part 3. I've been talking about a couple of articles related to FGMC, and the whole reason I was talking about them was because of this executive order that I haven't heard really anybody talking about, but we're going to dive into it. This executive order is called the Protecting Children from Chemical and Surgical Mutilation. And I'm not going to really read through this again because it's super boring as an executive order. But basically, the policy and purpose of this one, it basically states that the U.S. government will not support or fund medical procedures that change a child's sex, like hormone treatments or surgeries. And then it expresses some concern that these procedures can lead to irreversible harm, including infertility and long-term health issues. And then it defines what's a child as basically anyone under the age of 19. And then it also defines chemical and surgical mutilation as puberty blockers, hormone therapies, and surgeries that are intended to alter a child's physical sexual characteristics. And literally says chemical surgical mutilation, and this phrase is sometimes referred to as gender-affirming care. This right here, under Section 2, subsection C, this is the problem, where they are equating FGMC with gender-affirming care and saying that they are the same. This is where they will use those laws, the anti-FGMC laws, to go after trans kids. And in this section right here, they basically just criticize all the guidelines from the World Professional Association for Transgender Health, and they label them as lacking any scientific integrity. And it also directs our federal agencies to stop using the World Professional Association for Transgender Health, WPATH, to stop using their recommendations. And it instructs the Secretary of Health and Human Services, that would be Robert Kennedy Jr., that genius. It instructs him to review the existing literature on treating gender dysphoria in minors in this section. In Section 4, federal agencies are instructed to ensure that institutions that are receiving any federal research or education grants do not perform gender-affirming procedures on minors. And then in Section 5, the Secretary of Health and Human Services is directed to take actions to end gender-affirming treatments for minors within all federal programs like Medicare and Medicaid. And this includes reviewing and potentially revising related policies and guidelines. So again, here's the problem. Then in Section 6, the Department of Defense is instructed to exclude coverage for gender-affirming treatments for minors under TRICARE, which is the military's health insurance program. In Section 7, the Office of Personnel Management is directed to ensure that federal employee health benefit programs here, that they exclude coverage for gender-affirming treatments for minors. Then here in Section 8, the Attorney General is tasked with prioritizing enforcement against female genital mutilation and investigating potential misinformation or fraud related to gender-affirming treatment, as well as working with Congress to allow minors or their parents to sue medical professionals for damages resulting from any of those treatments. and also reviewing cases where states remove children from parents who oppose gender transition. And then Section 9 basically says that the agencies involved are all required to report their progress on implementing this order within 60 days. Section 10 is a severability clause, which basically just states that if any part of the order is found to be invalid, the rest still remains in effect. And the general provision just basically clarifies that it does not override any existing laws or create new legal rights. The only potential positives out of this is that the executive order explicitly directs the DOJ to prioritize enforcement against FGMC. And that could mean more resources and attention going towards protecting girls that are at risk. It also recognizes that FGMC is a serious human rights abuse issue, and it reinforces the need to prosecute those who engage in it or facilitate it. But it may also politicize FGM enforcement by comparing it directly to gender-affirming care, which are, two very different contexts. As we've went over before, FGM is a non-consensual practice, which is often performed on minors without anesthesia or medical standards, typically as some sort of cultural rite. And gender-affirming care, on the other hand, is medically supervised process that often involves, consent, parental support, and clinical guidelines. So there's two huge differences there. This EO really does conflate the gender-affirming care with FGM. It frames both as mutilation, which is deeply misleading and stigmatizing. It could also enable the misuse of certain FGMC laws to then criminalize doctors or parents who support their kids' gender transitions, even when it's done under medical guidance. There's also a risk of legal overreach. With parents trying to affirm their child's identity, they could face accusations of child abuse or neglect under this order. It could also cause problems with access to legitimate health care by threatening lawsuits and restricting insurance coverage and defunding clinics that provide this type of care. The thing is, this executive order just creates contradiction. On the one hand, it protects girls from non-consensual mutilation, but on the other hand, it strips trans youth of their right to access to care that they and their families may need. And it could be used to frame any sort of medical intervention for trans kids, no matter how voluntary or clinically justified, as human rights violations, while still ignoring the autonomy and identity of the kids themselves. And I'm not going to read this article on the forgotten history of female genital cutting in the United States, but it is a good read, and I do recommend it, especially if you're unfamiliar with the practice here. SEHIO, you may recall from my previous video, is the nonprofit organization that was founded by Maria Treher, the author of the two articles that I went over in the other two videos. If you're interested, I will absolutely do this as a whole nother video, a part 4 to this little series. Let me know in the comments if you'd like that, and let's have a conversation.